Okay, this is part 2 of sleep and rest. We had just gotten down to begin talking about some of the common sleep disorders. A lot of patients will have what's called restless leg syndrome, where they have uncontrollable movement of their legs during sleep and rest. This probably affects about 5 to 15% of Americans. Both children and young adults experience this, but it's really more common in older adults and often can be associated with low levels of iron. So if you're having patients with those two, with that symptom, then you may want to look to what have they had an iron level done lately. And sometimes it's associated with the use of antidepressants as well. There are some medications that can be given for that also. Hypersomnia is when people have excessive daytime sleepiness. They doze off, they nap, they fall asleep at times, and in situations where they wish they weren't having that occur. Sometimes other diseases like obstructive sleep apnea or narcolepsy can create what's called hypersomnia, and other disorders sometimes of the central nervous system, the kidney or the liver, or metabolic disorders can also make patients very, very lethargic and sleepy. And sometimes we notice when you get into mental health, you will find that patients who are depressed tend to have really excessive sleep and withdrawal patterns also that go along with that disease. Sleep apnea, we mentioned this a little bit when we talked about respiratory. It's kind of a periodic interruption of breathing during sleep, and the patient will just have an absence of air flow through the nose or mouth during sleep. Sometimes this is related to the back of the soft palate that collapses and kind of obstructs the airway. And these patients may have several or as many as hundreds of times at night that they may go as long as a minute or longer without breathing. And so what happens for a patient, and I'll try to find you guys a video on this so you can see what it looks like, but the person will, when they go to gasp finally after that, almost a minute's gone by without breathing, which is what occurs when their oxygen level drops and their carbon dioxide level rises, the person will take a big deep breath that wakes them up. And so if they do that all night, multiple times, then they're not really getting to REM sleep and not really getting effective sleep at all. That the same problem can cause them to have problems with increased blood pressure and pulse and even cardiac dysrhythmias. Patients will often have to, if it's diagnosed well for sleep apnea, then they may have to be put on a CPAP machine at night that kind of keeps their lungs partially expanded all the time, and they're less likely to have that problem. So, you may notice this even during the daytime when patients are sleeping. You may walk in and you see them breathing, or you're checking their respiratory rate just by observation. So it could be breathing cessation for at least 10 seconds is the definition, but many, many times it's going to be longer than 10-second gap. So just watching for that in your patients is important, because it tells you that likely they're not getting good sleep and the benefits of good sleep at night. These are just a little bit more definition about narcolepsy and parasomnias. Narcolepsy is a chronic disorder caused by the brain's ineffectiveness in regulating sleep-wake cycles in a normal fashion. It comes from the brain having an abnormality that causes that. And it's kind of odd if you've ever met somebody that had narcolepsy. The person may just experience a really sudden, uncontrolled urge to sleep that may last seconds to minutes. And this might occur during the daytime, even when the person has slept well at night. I had an employee one time that had this, and they were a new employee, and we really didn't know when we hired them that they had narcolepsy. And just to give you an idea of how strange this was, this person was a CNA, and they had been training with people, and they knew how to do their work well and really didn't have any performance issues with that. But the person would be carrying something down the hallway and just all of a sudden had to lean up against the wall and just would fall asleep standing up. And some other employees would look down the hall and be like, why is Jim asleep against the wall? And then come to find out the person was under treatment for narcolepsy, because when we would try to awaken them, they would have, he had like kind of slurred speech. Sometimes he would get weak, and then sometimes you would kind of startle him awake, and it took a little bit for him to kind of figure out where he was and what was going on. And a lot of times their performance in activities is really affected poorly if this happens quite a bit. But they could be talking to you and then just suddenly just like go asleep in the middle of a sentence. It's a very odd brain activity. It's not as common, but some patients do have sleepwalking and talking. That occurs in usually in stage 3 of NREM sleep, and it can usually 1 to 2 hours after the person falls asleep. So, it's kind of early in the sleep cycle. The person may leave their bed, walk around, and really have no awareness of their surroundings. They may be doing common conscious motor activities like brushing their teeth or their hair, make some coffee, but they don't wake up. And so it is a safety issue, as you can imagine. And then even when you do wake them up, they may have no memory of what they've done while they've been awake. Bruxism is the grinding and clenching of teeth, which often will occur during stage 2 of NREM sleep. It can really erode the tooth enamel and loosen their teeth, and it's very audible and noticeable if you have a patient that's doing this. Another common thing that can happen with some people is night terrors. These are more common in children, but they will suddenly arouse and just be extremely physically active, often having hallucinations, just look terrorized, crying, screaming in fear, thrashing about. And it really takes parents or other caregivers to really try to, control them and console them at the same time. The patient will appear to be fully awake, but in reality they're not. And sometimes the children are very hard to awake. And some of these episodes can last from 10 to 30 minutes. And then they will awake and have no memory that even occurred. Last of all, enuresis is a nighttime incontinence past the stage at which toilet training has been well established. And sometimes this has been kind of thought it was because somebody was dreaming. However, most of the instance with enuresis happens during in REM sleep, not in dream sleep or REM sleep. So, but it's usually kind of in the early first third part of the night, and the child is usually kind of difficult to arouse at that time as well. This is question 3 for you. Which sleep disorder would the nurse most likely need to include safety measures in the client's plan of care? And here the answer is narcolepsy. Obviously, it would be nice for if it was bruxism, but that's not an option. But narcolepsy, as I described the employee, you can imagine if they get weak in the knees, they're very apt to fall and have an accident because they just fall asleep whatever they're doing. Imagine the person who has narcolepsy who would be lifting or caring for patients or working some kind of machinery and then just instantly, uncontrollably fell asleep in the middle of that. Could have some huge safety problems. So part of our goal is to really promote sleep, and like I said before, that doesn't always happen in the hospital setting very well. But ways that we can do to help support that is to cluster, meaning put all at one time, or schedule all together as much of the nursing care as we can at one time, and so that they have longer interrupted periods of time when they can sleep. Create a comfortable, restful environment. They may need to have on the right clothes. They may need to have enough blankets, comforters, pillows, whatever it is that feels comfortable and restful for them. Decrease the sounds, decrease the stimuli in the room. Get the lights to maybe there's somebody who likes a very light music in the background, but try to create a restful environment that's individualized to what works for that patient. We want to promote comfort and relaxation. Sometimes you'll have other comfort things that you can do. Some people like to maybe take a bath right before bed. For some people, though, taking a bath makes them more alert. So it just depends on the person. But often giving somebody just a little bit of fluid to wet their mouth, not drink a whole lot, but some of that, cool cloths, or give a massage or a back rub are really good things that help people get relaxed. Some people really have bedtime rituals and routines, and it's important to find out what that is. Maybe they read before bed, maybe they watch TV, maybe they have some type of meditation or praying, things that they do. And so trying to get people into the normal things that help them to be comfortable and to relax and kind of do the normal things that have worked for them is very important. So we need to assess them really if they're having sleep difficulties. Is it something about their physical care? Is it something about the environment that we have them in? Is it some kind of medication that we have them on that's preventing sleep or interrupting sleep? To kind of really do a great assessment with the person up front to find out about some of these factors is very important. And then design your interventions around what are the causes of the sleep disturbances so that we address our interventions directly to the etiology of the problem. Last of all, offering foods that promote sleep. Some of you may be aware, some people like to take warm tea, warm milk, a little snack or something. Making sure that we maintain safety of the client. Some patients, if they have sleep disorders, may wake up and not quite recognize their surroundings. So typical things like keeping the side rails up, keeping all their belongings close at hand and visible to where they can get to things. And then just teaching them and making sure that they understand about their medications are very key as well.